This is Keith Cunningham with Keith Cunningham TV and SPD Fanatics. Today's guest is a seasoned expert in sterile processing with more than 20 years of experience in healthcare. A proud veteran of the United States Marine Corps, he began his career as a surgical technologist before advancing to become a sterile processing manager at renowned institutions like the University of Kansas Health Systems, Overland Park Regional Medical Center, and St. Joseph Medical Center. Currently, he's serving as an application specialist. Please join me in welcoming Brian North to the show.
Thank you. How's it going, Keith?
Hey, good to see you. It's been a long time.
Yes, it has. Yes, it has.
Yeah. So, Brian, I'm gonna ask you now. Could you share with our viewers the story of how you first got involved in sterile processing?
Absolutely. Absolutely. So, what made me get into the medical field, I'll kind of step that up, start there, and then actually get into my sterile processing experience. What made me start there and then actually get into my sterile processing experience? What made me get into the medical field is my grandmother. She had a stroke, long story short, and she was placed on the vent. And long story short, that vent was not necessarily cleaned properly or cleaned to the specs that it was supposed to. She got a nosocomial infection and never recovered from it. So the healthcare field became near and dear to my heart. And so that made me want to really get into healthcare and see about healthcare. So fast forward, I went through the Surg Tech program, was a Surg Tech, and did that for on and off for about 4 years, and never even knew what sterile processing was or heard about sterile processing. But when there wasn't anything to do, I would go down in sterile processing and help. And learned about sterile processing. It intrigued me. The more I got involved in it, start educating myself more on it, and I would do sterile part. Then I got a job working in sterile processing. Was doing that off and on. Then I went into sterile processing full time. Worked in sterile processing and did a scrub tech PRN. Did that for a while, worked my way, short story, up the ranks of sterile processing. And the more I worked myself up, the more I got intrigued about it, the more I wanted to educate myself, the more I wanted to not cut corners. Because again, that's something near and dear to my heart. That's my family that's on that table. That's my family that could be those instruments used. So I don't take that part lightly. And 20 years later, here I am, currently working with the Cinco Health as they recently just changed the name from to a platform specialist from application specialist, and love what I do. I get to still start processing with other people where it may be just a job to them. It's my passion. I eat, live, breathe sterile processing. So I want to know all the ends of sterile processing. I want to help in any way I can. And in the current role, I can still help in sterile processing with the tracking system and provide information that way, and provide a platform as to where we can get the right instruments to the patient at the right time when the surgeons need it.
Yeah, I remember when I first met you and worked under your direction. I say you was the best manager that I worked for.
Wow. That means a lot. Thank you.
Yeah, you really encouraged me to keep moving forward.
I appreciate that.
So in sterile processing, and I try to tell other sterile processing technicians that we are the first line of defense in infection prevention, and how important that role is.
Not only that, we're the backbone of the hospital, because if you think about other than dietary service and environmental services, we are the other ones that touch almost every area of the hospital. Not just surgery. We're not just there for surgery. We impact the clinics. We impact even the lab, because some of those pneumatic tubes, we do process and clean those. And then we also affect the ER. inpatient areas. We do instruments and stuff for them as well. So it's not just the surgery that we impact, but different areas of the hospital and clinics as well.
I recently posed a question in several sterile processing groups on social media asking what is the biggest challenges in sterile processing, and surprisingly over 90% of the technicians pointed to the pay rate as a major concern. So what are some of the ways that technicians can increase their wages in sterile processing?
Number one way that I say is first and foremost, educate yourselves. You've got to make yourself marketable. And the way that you make yourself marketable is don't wait till they tell you to get certified. Don't wait to educate yourself about what the new processes and amendments are. Do it ahead of time so then you can make yourself marketable so that you can sell yourself. You got to sell yourself, be able to speak to different areas of the hospital. The other thing is you want to go out there and you want to search and research for yourself to see what the going rate is in other areas around where you're working at. See what those prices are, and then bring that to your leadership to match that. But education first and foremost is the way to go. You got to make yourself marketable. You got to be able to sell yourself. Tell what makes you different from the other person. Why should I number one, why should I hire you? And number two, if you're asking for a raise, what is it that sets you apart from the rest?
Right. So as a manager, now this can really give good advice to technicians. You being a manager, what do you look for when, as an employee, um, as far as promoting, seeing potential in that employee as a lead tech or a supervisor? What are some of the things you look for? Uh, you have a lot of people that, I'll say myself, I think work ethic is a strong is one of the strong ones, and then your commitment. We know on time, being at work, but not complaining, but you know, following through with the task that's given. So, what do you look for as a manager?
So the what I'm going to look for as a manager is all of those things that you mentioned. But when I'm looking for my leadership, I'm looking for a person that is using initiative, doing things without being told, and doing those things the right time at all times, even when no one else is looking. They're still doing it the right way every single time. I'm going to look at the person that is the team player, that's rallying the team, that when the team is not necessarily having a good day or something, that person is positive even in the bad times, that's rallying the team together. I'll use you as an example. When you were up in the we had the clinic area that we were re-sterilizing instruments for the clinics. One of the things that I always noticed about you is no matter how much of the work we've done, no matter how short we were, your attitude was the same way every time. You went in there, you put your head down, you got it done. You didn't involve yourself in the drama. You set yourself apart from it. A leader has to be a neutral person. They don't get involved in the drama, yet they bring the team up and keep them positive and keep them moving in forward progression. That's what I see in the leader. And sometimes that's hard because it's hard not to be into that crowd. It's hard not to complain when you're short staffed, but you have to keep it moving forward because here's the thing about a leader is going to set the tone for the rest of the department. So, depending on how I come in there as a leader, it's going to depend on how everyone else is going to flow because my attitude is going to dictate the way the rest of the department is.
Well spoken. I appreciate that. I really appreciate that.
Mhm.
So, what are some of the, we know certifications, but what other positions do? Because I hear a lot of complaining about, about the work volume, and we're not getting paid enough. But seem like a lot of the technicians are just stuck in that one place and don't look beyond where they at to see themselves at a higher place. So what other positions are there to put that they can look forward to put themselves in.
When you say what other positions are you talking about other than just a tech position?
Right, you can start there, but I think a lot of people come in and that's all they only see. They don't have a vision to see themselves in a higher. Because I keep hearing the same thing over and over with pay, and I don't hear anything about advancing.
So part of that is sometimes we may have to step out of one of the things I see some people, they complain about the pay of where they're at, but they're not willing to step out. You may have to step out of the organization that you're in to get a better pay because the thing is number one, know your worth of who you are as a person and as that tech. So nobody can tell me what my worth is. I know what I'm worth. So if they are not giving me my worth here, then it's time for me to branch out. And does that mean that I branch out and not necessarily ever come back? We never know. So you don't necessarily want to burn the bridge that you're at either, because you never know when you may have to come back to that. So do it the right way. What I mean by that is I may have to branch out and it may take me somewhere else. It may be for a season, it may be my new endeavor. For example, if I'm not getting the pay I need here, then it doesn't hurt me just to see what else is out there. I don't have to go anywhere, but I can see what else is out there. This can be used as a tool for two things. I can use that as a negotiation tool to go back to the current organization that I'm in and say, hey, I'd like to stay with this organization, but such and such is offering me this amount. Where is there any way we can negotiate this? Because again, I'd like to stay with this organization. Can we negotiate this? If they come back with a counter, they may come back with a counter. They may say there's nothing we can do. If they say there's nothing we can do, you have to be strong enough to step out on faith and move forward when they say that. Because a lot of times what we'll do is we'll say, okay, here is offering me this, or you all able to counter, and they'll say no, and then we'll stay and settle because we're scared to take that step. You have to be willing to take that step if that's what you really want. The other thing is I have to be sometimes it may take some more education on my part, more schooling to move to the next level. I.e., if I want to move into a leadership position, I have to get myself ready to be a leader. I can't have the mindset of a tech and then expect to step in the leadership role and just stay the way that I was currently. I have to be able to move to that next step. I remember a director. He's passed on, but the director told me one thing, and it stuck with me my entire career until even now. He said, "Don't dress for the part you're in. Dress for the part you want to be in." So we should always be thinking one step ahead.
Wow, that's some good advice. Some real
Mhm.
good advice. So, what do you think as far as technicians just starting out in the field and they hear about the money with traveling? Do you think they should get more experience before they try to venture out and travel, or should they just?
100%. 100%. Here's my thing with the traveling is because a lot of times when you step out, you don't set yourself up for success when you brand new to the field, less than a year, and now we want to jump out and start traveling. I say give yourself anywhere from 3 to 5 years. And the reason I say that is because you're going to be solid. Number one, solid where you're at, solid to be able to step and move into that. By that time, the other thing you want to do is all of the conferences. Get out to these conferences. Get your certifications that you can. Start reading the AMI and ARN standards. Learn those standards. Those are your guidelines, your Bibles, if you'll speak, when it comes to SPD. Know that backwards and forwards, because one of the things that we also need to do is just because my leader tells me, it doesn't mean it's right. Know it for yourself. Study it for yourself so that you know what the standards are, so that you can go back and say, yeah, that is right. That is right. Or, well, I don't think that's correctly how it is. And Be evidence-based. When I say that, as far as evidence-based, don't be rude about it, but maybe pull that leader to the side and say, well, help me understand, because right here in this, the standard says this. So study to show yourself approved. Educate yourself. Don't just go by what somebody is saying. I used to tell my techs is, don't just sit here and believe it because Brian said it. Find out for yourself, know for yourself, because if I'm human just like you are, there may be something that I'm saying that's in error. And I'm not afraid to admit, to say, okay, you're absolutely right. I was wrong for that. And then I'm going to go back to the everyone else and say, you know what? I stand corrected. This is actually the correct information on it.
Yeah, Amy standards are definitely our guidelines and standards in which we should go by. I think it should be all across the board that we all follow those guidelines and standards instead of doing different things.
I honestly don't think that we look at those guidelines and stuff enough, because if we looked at it enough across the board, we wouldn't have a lot of the errors that we would. There needs to be more standardization than what there is. I definitely would say that.
I noticed when I was educating and going to different facilities, you had different technicians in different departments all doing different things. When they switch roles, they have their own way of doing things, and it wasn't standards and guidelines across the board.
Even to that point, even when you have different leadership changes, a leader is so used to the style that they've been using for years and years that they go with that style. And one of the things about sterile processing is an ever changing field. And you have to look at those guidelines, look at those amendments as they change. One of the things that just recently changed was we had the water quality is now a standard, ST 108. It has become a standard. It used to speak to and say, this is a recommendation. Now it's this shall be done. So now it's no longer a recommendation. So, just for example, those are one of the things, and you have to stay educated. I can't just think, okay, this is how it is, and this is a standard. It changes constantly, and you have to continue to keep educating yourself. That's the other thing, is I would say, is even as a tech, I have to continue to educate myself. That's what those conferences, even the local chapter conference as well as the national conference, going to those things, you're going to see the state of the art stuff. You're going to learn the latest thing. You're going to get educated, and you're going to get those CEs and everything that's going to educate you.
Yeah, I had a great time at HSPA in Las Vegas. That
I did
conference
too.
was, you was there. I didn't see you there. Oh man.
Was there as a vendor, and I got to see some of the different speakers and everything. So yeah, I had a great time there as well. Absolutely.
Yeah.
I was there with Asenco. We was actually in the 3M booth when 3M they were talking about their new Bowie Dick, the electronic Bowie Dick. We were actually the platform for them. Yeah.
Okay.
Yeah.
Yeah, it was a great time, wasn't it?
It absolutely was. And that's the thing, is you have to be able to get out there. And the other thing is, well, some people will say, it costs a lot of money to do that. But here's my thing. If you want to, you talk about getting the money, the other thing you have to do is be willing to invest in yourself. Invest in yourself. Do the lean projects, do the Sigma sixes. Yes, it's going to cost, but here's the thing: a lot of times, if the hospitals see the drive in you, some of those hospitals will go ahead and cover that for you and give you the grant for that. But you have to be willing to show that you're going to invest not just in yourself, but in the hospital as well.
So for the viewers and the technicians that I keep hearing asking about different roles that they can elevate to, let's just name off a few roles that you don't have to just stay as a sterile processing technician. You can also elevate to certain roles.
So there are different roles within sterile processing. And I'll just use KU as an example of when we were there. They had what's called the ORAs or ORLs, you'll hear them. Those are the ones that actually are the go between sterile processing and between the OR. They're going to round the rooms in the OR to make sure the ORs have what they need. If they are missing something, they're going to communicate that back to sterile processing and make sure that we're getting that ready in a timely manner so that there's no delays in the cases. They're the ones that's actually going to be pulling the cases throughout the day. And then they'll also be coming in maybe an hour or two before the first case started to make sure that those first case have everything that they need so that it's a smooth transition once those cases started. You have your lead techs. Your lead tech is what I call the first line of leadership, and they're actually working leaders. So they're down in the actual department, and they're making sure the flow of the department goes like it's supposed to be. They're making sure that if there's something that's needed for a turnover, they're ensuring that that turnover is going through the process and that there's no breaks in the number one in the communication with the staff. For example, the decontam staff and the clean side, they're making sure that that instrumentation gets pushed through in a timely manner so that it's not late for the case. You have your supervisor who is the overseer of it. They're controlling the entire flow of the department, if you will. You have your educator. So they're my educator or my trainer. They're training and orientating the new people. They're making sure that that new person that's coming on is paired up with a preceptor. You also have your preceptors who are right there side by side with that new orientee, ensuring that they not only learn the basics of sterile processing, but they're also learning the policies and the way that each hospital is doing what they're doing, because we have a basis no matter what hospital you go to. There's a standard baseline of SPD that's done no matter where you're at. But then you also have each hospital may do something just a little bit different, or they may have different uh, a different platform that they're using. They may have a different way that they are tracking their information or capturing their information. So that's where the preceptor is going to be able to help me out specifically for that organization. You have your instrument coordinators. The instrument coordinators are those that are actually making sure that the instruments function like they're supposed to. They're going to be in charge of new instrument builds. They're going to be in charge of making sure that if we have some instruments that need to be ordered, they're going to be the ones that's ordering those, as well as tracking and keeping up with where those instruments are if they've arrived. Once they arrive, they're going to check them in and get them lined up with the sets that they need to go to. They're going to make sure that we have what we need as far as for the cases. If there's some type of special instrumentation that needs to be brought in, then that instrument coordinator is the one that's going to be coordinating with the vendor, making sure that those trays are ordered or set up so that the surgeon can have those. And that's just to name a few. Some you have other areas that may break it down even more, but that's just to name a few.
And then, as yourself managers, then you go all the way up to directors.
Exactly. And those, your managers and your directors, so that can get a little different as far as what one manager does, as far as what a director does. Because when I was a manager at KU, one of the things we did was we were in charge of doing the budget. But as went to some of the other hospitals, the director is actually the one that's in charge of the budget and everything. And we would just send, as a manager, we would just send some suggestions and they would add it to the budget. We would look at the budget together. But at KU, the manager was actually in charge of getting that budget together. They then would actually look it over with that director. And of course, the director is the one that's actually going to be the final say so and the final sign off on that as well. And then as a director level, the director may be in charge of multiple SPDs over multiple areas.
So a lot of technicians have a lot to look forward to
Absolutely.
if they can see past where they at.
And the other thing that I would like to point out is when I get just because I go up in those leadership paths, the path may you have to be ready to number one, like I made out and said earlier, is you have to be able to be neutral in all of those positions. The other thing is just because I go up the ladder, it doesn't mean my tasks get easier or my stress level gets
Right.
easier, because now where it was just me as a tech making sure that I was taken care of, as I go up in the ladder, my the person or people that I'm responsible for, now it's not just about me, it's about that staff as well.
I thank you, Brian, for your time and giving game to the sterile processing technician community. A lot
Anytime,
of information.
anytime. And any questions, anything out there, I'm on LinkedIn. Always reach out to me, and I'll be happy to help out.
Now, are you on any other platforms or social media that anybody can, if they got questions?
I'm on LinkedIn is probably the best way to reach me on LinkedIn. I also am on Asenco. I'm on LinkedIn as well as that. If anybody's interested in what Asenco is, that platform, that tracking system, reach out to me there and I'll give you some more information on that as well.